Alright, ladies and gentlemen, so today's topic is going to be on the topic of hip snapping, also known as coxa saltans. In terms of what it is just as the name suggests. It is actually a condition where your tendon actually rubs or subluxes across a joint. Sometimes this may be visible to the eye, and depending on the site and region, sometimes this may also be audible, which means that you can actually hear it depending on the site. So hip snapping is actually separated into three types. First one is also known as the external snapping, by which the actual IT band that actually runs all the way across the joint subluxes or rubs across the greater trochanter of the femur during repeated flexion motion or when you're bending your hip, and as a result, producing a loud pop sound or a snapping sound. And the second type is also known as internal snapping, which is actually characterized by a loud snapping sound, and which actually happens when the iliopsoas tendon runs across the iliopectineal prominence. And the last type is actually called the intra-articular snapping, which is actually caused by loose bodies. It is actually often associated to labral tears and synovial chromatosis. And some of the common population that may be affected by this problem are dancers, runners, weightlifters, or gymnasts. And in terms of the clinical presentations for these individuals, there may sometimes be pain or no pain. It tends to get worse with activities, and sometimes the snapping is actually brought on by repeated motions. In this case, continuous flexing the hip and also extending the hip as well. Sometimes if it is actually associated to a labral problem, there may be clicking or locking. And as discussed in some of the literature, some of the differential diagnoses include the following: acetabular labral tear, greater trochanteric or iliopsoas bursitis, femoral head avascular necrosis, hip or iliopsoas tendinitis, or iliotibial band syndrome. Also, the last two include intra-articular loose body of the hip and also synoviovitis. And for assessment, it is very important to locate the site of snapping. Also, identify the type of snapping, and that can be done through palpation, observation, or real-time imaging methods. For both, a positive test is actually identified when the snapping sound is reproduced during the hip motions, in this case mainly flexion and extension in a closed or open chain angle. An ultrasound can be used in combination with the clinical examinations. In this case, the hip positional testing, the Uber testing, and the dynamic ultrasound actually helps to identify the presence of any tendinitis, muscle tear, or inflammation. It is very important to acknowledge that the use of imaging is majorly for the purpose to rule out any structural related problems related to the snapping, in this case, the anatomical variation. In terms of management, it is very important to think about what to treat based on what is found. In this case, if pain is a problem, then pain has to be treated, but at the same time, it is important to address the source of the problem as well. Some of the conservative treatment also include manual release or active strengthening. And if muscle weakness is a problem, active strengthening can be very helpful in this case. It is also very crucial to address any kinetic chain deficits. And since this is a problem related to the increased levels of activity, it is also very important to think about activity moderation. The medical team and the allied healthcare team can work together to ensure patients a good continuity of care. If you haven't done so, please be sure to check out our other videos in the education discussion series. Again, thank you very much for all of your time. Be sure to like and subscribe for more.